And like I said, I have so much. Styles have platelet dysfunction disorder. As soon as Styles got his surgery done, Styles are picking up an infection in the hospital. Oh my God, what is it called again? Oh my God, when I remember it, I'll let you guys know. But Styles develops febrile seizure right after surgery. So febrile meaning fever. So Styles will get seizure every time he has a fever. And then that graduated to grand mal, petit mal, to now full-blown epilepsy. So Styles is epileptic. Styles have mild scoliosis. Styles have developmental delays. Styles have something that I can't say right now because I don't want to be attacked on here. I'm still learning guidelines and violation lines, and even though I'm talking about my son, I don't want to offend anybody out there. But Styles have a lot going on, and what I try to do is not use his diagnosis as a label or as a crutch to hinder him. I punish Styles like a regular normal child. Yeah, I do. I talk to him as normal, and even though I know within myself he's not fully understanding what I'm trying to say, I still try to speak to him that way, you know. And I try to do a lot with Styles. So Styles developed the seizure. That was a new challenge when I went back to Jamaica. A new challenge. We still was living in the hospital. I had to make sure that Styles' oral hygiene was like no other, because the least unkept situation I have with Styles' mouth could put his heart at risk for a heart disease called endocarditis. It's an infection that he probably would have gotten surgery to get it situated or be on antibiotic. So at one point, Styles couldn't go and get his teeth brushed without being on antibiotic. Then we found out that Styles had to be seeing endocrinologists for issues of his private area because he had something called hypospadias. So Styles had hypospadias, so he was going to endocrinologist for his breasts, because after taking a certain medication he grew breasts. What else? He ended up with a platelet dysfunction disorder, and every time Styles had something, I seem to be the one who always pick up on seeing these things, and the doctors just can't see why. Hello, I wasn't working, I was home. What else do I have to do but pay attention to my child?